She said this is a DeWine Fabrics design. The time we're in today is Ohio University's Heritage College of Osteopathic Medicine. So we thank all the folks who are there, and all the graduates and professors who help our healthcare system in the state of Ohio. Let me start by thanking Senate President Obhoff, Speaker Cupp, members of the General Assembly for their leadership and assistance in the Controlling Board's recent approval of $419 million in CARES Act funding to help our fellow Ohioans. This money will be used for small business grants, $125 million, rent and utility assistance, that's $50 million, grants to bars and restaurants, $37.5 million, help for our hospitals, $62 million, in our colleges and universities, that's $100 million, and support for Ohio's world-class art organizations, as well as nonprofits, and that's a total of $25 million. Again, I thank them, all the members of the Controlling Board, for getting this approved. It will do a lot of good. 1 week from today is Election Day, and so we have the Secretary of State ready to talk to us and give us kind of a report. Frank LaRose, Mr. Secretary, I can see it looks like you're in your office with a view of the State House there. That's a pretty nice view. Tell us where we are a week out.
Well, thank you so much, Governor. You're right. It is a week before Election Day, but of course, we're 3 weeks into election month in Ohio, and we've already seen record-breaking numbers of Ohioans taking advantage of early and absentee voting. You can see the countdown clock behind me, 6 days, 17 hours, 29 minutes, and 40 seconds until the polls open on the morning of Tuesday, November 3rd. And there are a couple things I just wanted to talk about today, Governor. I really appreciate you giving me the opportunity to discuss a few of these things. Of course, way back in the spring, we faced an unprecedented challenge, and Ohio's elections officials rolled up their sleeves to make sure that we were ready. We launched what we called the Ready for November Task Force, where we had a weekly meeting that was shared here on the Ohio channel. We set a few key objectives. Of course, one thing that we wanted to do is make sure that we got plenty of people registered to vote, because it's hard to get voter registration done in the traditional ways. And I'm happy to report that we surpassed 8 million registered voters in the state of Ohio. That's something that we're really proud of. We also knew that we needed to launch an unprecedented effort to recruit plenty of poll workers. I'm happy to say that over 140,000 Ohioans came to our website and signed up to be poll workers. And as we stand today, well over 50,000 of them have been trained and are ready to go to open our polling locations in a safe and accessible way on Tuesday morning, November 3rd. One of the other things that we really focused on was trying to maximize early and absentee voting. And I'll tell you, that has been a humongous success. We have seen a doubling in the number of absentee ballots that we've seen in past years, and we've seen it triple as far as early voting goes. And so by all accounts, this has been a very successful effort. And of course, we had to make sure that the right health and safety protocols were put in place. So we worked with the Ohio Department of Health and the United States Centers for Disease Control to put in place a 61-point checklist so that every voter and every poll worker can feel safe and comfortable coming to participate in early in-person voting as well as Election Day voting. Now, the bottom line is this. There have been some folks wondering, will Election Day happen as scheduled? It, of course, will. Election Day is unchangeable. The first Tuesday after the first Monday in November is set in both state and federal law. It has been unchanged since 1843. You can contrast that with primary elections, which routinely do move over the years. And we know that as a result of the pandemic, some adjustments had to be made to the way that Ohio conducted the primary back in March and, of course, concluding at the end of April. But the general election day is set, and it will not change. The polls will open at 6:30 a.m. on November 3rd, and that's important for people to know. They'll be open until 7:30 that night. Now, just like I said, we're all excited about Election Day, but you don't have to wait for Election Day, because in Ohio, we have election month. In fact, voting continues today. Voting continues tomorrow. Voting will be happening on Thursday, Friday, and as well as Saturday and Sunday. We're one of very few states in the nation that offers weekend early voting. Ohio has that. We have Saturday early voting. We've got Sunday early voting. We've got convenient evening hours this week. In fact, on Monday, the day before the election, early voting continues until 2 that day. And it's something that Ohioans are taking advantage of in really massive numbers. Now, I talked about that health and safety plan that we put together. We launched this 2 months ago, a 61-point checklist. Every Board of Elections is required to follow that checklist. What that'll make sure of is that, again, if you feel comfortable going to the grocery store, you should feel comfortable coming to your polling location. A lot of the same precautions are in place. You're going to see 6 feet of social distancing. You're going to see personal protective equipment being worn by both voters and, of course, our poll workers and any elections observers that may be there as well. You're going to see common sense things like having a door in separate from a door out where that's possible. You're going to see something as simple as a door stop so that people aren't touching the door handle all day long. Of course, wiping down of surfaces. We've been able to field massive quantities of personal protective equipment because of patriotic Ohio companies that have stepped up and answered the call and donated PPE. But we also took the vast majority of our federal dollars and pushed them out to the counties so that they could spend those dollars to procure the necessary PPE to make sure that it's safe. I talked about us wanting to maximize early and absentee voting. That's been a humongous success, Governor. And I actually have new numbers to report. As of today, 3.2 million voters have already requested an absentee ballot. 3.2 million Ohioans have already requested an absentee ballot. Now contrast that to 4 years ago, the number was 1.6 million. So we've clearly seen a doubling in absentee voting in Ohio. The bottom line is this: today is effectively the last day. The law says you can wait until Saturday, but that's a bad idea. Today is effectively the last day to request your absentee ballot. So if you want to be one of those millions of Ohioans who is voting from the safety and comfort of home, today is the day to do so. You can do it easily by returning the absentee ballot request form that we sent to all 8 million Ohio registered voters, or if you lost that or don't have it, you can go to voteohio.gov. And on that website, you can print the absentee ballot request form. Heck, if you don't have a printer, you can even make your own just using a plain piece of notebook paper, and we give you all the instructions right there at voteohio.gov. We've also seen 1.5 million Ohioans who have already returned their absentee ballot, but here's a reminder. If you requested an absentee ballot and it's sitting there on your kitchen table, what are you waiting for? Go ahead and fill it out. Do just like what Lauren and I did. Fill out your absentee ballot, put the appropriate postage in on it, and mail it in today. And once you do, you can go to voteohio.gov and track your ballot to make sure that it's received by your county board of elections. Now, we've seen over 750,000 Ohioans that have taken advantage of early voting. That's 2.5 times the number that we saw in 2016. Ohioans are clearly enthusiastic. Now, you may have seen some lines over the weekend. Of course, our board of elections work to keep those socially distanced, so it may look like a longer line than it actually is, but those lines move quickly, and that's a sign of enthusiasm. Ohioans have 216 hours of early voting, and Ohioans are taking advantage of that enthusiastically. And so if you like that in-person voting experience, don't wait. Go to voteohio.gov to find the hours and locations for early voting in your county, the location for early voting in your county, and make sure to make your voice heard. We've also seen Ohioans that have cast their ballot in huge numbers, 2.2 million, as I already said. And we also know that 840,000 ballots are still out there. So again, if you're sitting on that, make sure to get it returned right away. Something else I want to address, Governor. There's been no shortage of disinformation and misinformation out there. Now, Ohioans won't be fooled. Ohioans know that the trustworthy source for elections information is your county board of elections website or the Ohio Secretary of State website, voteohio.gov. But there are folks out there that want to spread false information. If you believe that you're seeing false information, intentional disinformation about elections, report it. We don't tolerate that in Ohio. We don't tolerate voter intimidation. We don't tolerate disinformation. The way to report that is on our email system. It's report@ohiosos.gov. That's monitored 24 hours a day, report@ohiosos.gov. And I've got a success story. Because of a thoughtful Ohioan that reported to us an incident of voter intimidation that was targeted particularly at the minority community, a really ugly and pernicious act of voter disinformation. There's a Cleveland grand jury today that actually just indicted 2 bad guys who are going to face justice for it. Our office played a role in helping to make sure that these people face justice because they were trying to confuse and intimidate voters. We won't tolerate it. Anybody that thinks that they're going to get away with that kind of thing has another thing coming. We don't tolerate that in Ohio. Ohioans know it's easy to vote. It's easy to vote in the Buckeye State. And now the bottom line is this: make your voice heard. There's no excuse for not voting. You've got a whole month of early voting, a whole month of absentee voting, and you've got in-person election day voting. And when this is all over, Governor, Ohioans will know it was a fair and honest contest. Now, one last thing about how we report election night results. We always report an unofficial result on election night. Now, what does that mean? That means we report every early vote, every absentee vote, and every in-person election day vote that's come in so far, but it's never the final story because Ohio boards of elections have 10 days to receive ballots as long as they were cast, as long as they were mailed by Monday, November 2nd. As long as it's a legal ballot, it deserves to be counted. And so when we have that unofficial result on election night, it's going to be a snapshot in time. The official result a few weeks later is the one that really counts. But here's something that we're doing that's getting a lot of attention around the nation. We're also on election night going to report the number of outstanding absentee ballots. That's a number that'll tell us how many ballots are still out there in the postal system that are waiting to come back. And that'll give Ohioans a good sense of whether that's a conclusive result they're seeing on election night or not. Again, the bottom line is this: if you got a ballot, mail it in. If you want to vote absentee, request that absentee ballot today. Whichever method you choose, make sure you vote, Ohio. Thanks so much, Governor.
Secretary, thank you very much. And thanks to all the poll workers who are going to be there next Tuesday. And thanks to everybody at the Board of Elections today that are working hard to see that people can vote today. Thank you very much. We appreciate it. Well, sadly, the red tide of the virus continues to spread throughout Ohio into every corner of this state. There's no escaping it. 82 of our counties are now classified as high incident spread counties. Only 6 that are not. Every Ohioan needs to have an understanding of exactly what is going on in their own community. They need to understand what the data is, what's happened in the last 2 weeks with cases, hospitalizations, et cetera. They need to understand the extent of the spread in their community. And that's why we continue to do these press conferences. That's why we post this information up online every day. So with that in mind, let's look at the numbers for today. As we look at these numbers, I think every Ohioan needs to be alarmed by what we are seeing. As you can see, over 2,500 new cases. Again, 22 new deaths, 198 new hospitalizations, and 20 new ICU admissions. It was not that long ago. When this number, as you recall, 3 weeks ago, 3.5 weeks ago, it was hovering around 1,000, and we thought it was going to drop and stay below 1,000. So this is dramatically, as you can see, gone up. Let's look at our 88 counties now. 88 counties in order, all the way down. Again, this is the highest spread to the lowest spread. And again, this week we have colored in blue all the counties that are high incident counties. These are counties that have a high incidence. And again, you will see that just a handful, 6 counties at the bottom, do not have high incidence levels. Again, evidence that this is just absolutely everywhere. High incidence means the county has had more than 100 cases per 100,000 residents over the last 2 weeks. This number is the distinction that the CDC makes between a county with a moderately high level of spread and a high level of spread. We know that a high level of cases in the community just makes it more dangerous and increases the risk of catching this infection from someone else. Let's go to the top 20 counties slide. Again, these are the top 20. All areas of the state continue to see this increase. But if you look at our top counties, again, you'll see that, the first 10 counties are, some of the smaller counties of the state. You'll see some of the counties with, this is over 8 times the high incidence rate. This is, 5 times, 4 times. So you can just see that some of the very, very high incident counties are just literally off the charts. And that is certainly very concerning. Eric, let's look at the hospitalization map as well. And again, this tracks the entire period from back in April to the present. And one of the things that you will see, you'll see this color, the light blue is total hospitalization, people in the hospital. ICU is people in ICU. Vent, that's the yellow, and that's people who are on ventilators. So you can see how those numbers are moving. And again, this is a snapshot of how many people are in the hospital. So what you're seeing, of course, is a much steeper curve than we saw in June. Certainly a steeper curve than we saw before. We have seen peaks in the hospitalization before, once in the spring, and again the summer. The current increase in utilization is noticeably sharper, steeper than the increase we saw during the summer peak. Based on the trajectory of other early indicators, we've likely not yet reached the top. We have no indication that we've plateaued out at all. COVID positive utilization has basically doubled from COVID positive ICU utilization has doubled from the beginning of October, and that is very concerning as well. Again, we're not to the point where any of our hospitals are overflowing, but the trend lines are not good. As you can see, this virus is spreading, and it is everywhere in Ohio. It is community spread that is driving this. When you see numbers as high as we just looked at, that indicates that virtually every county has, except 82 counties have this high spread, which means it's out in the community. The community spread endangers our schools, our nursing homes, and our hospitals. Take a look at the slide that we have right here. Is a cause and effect. Community spread caused by these things and other things lead to problems in our nursing homes, our schools, and in our hospitals. It is cause and effect. As the virus spreads in the community from gatherings where people aren't wearing masks or aren't social distancing, it is directly impacting our ability to keep our schools open, directly impacting our ability to protect our elderly, those who are ill, who are in our nursing homes. And it directly impacts ultimately our hospitals. And if it continues, and we possibly can see our hospitals overrun, things that we've seen on TV but have not yet experienced in Ohio. And it's something that we certainly do not want to experience. And again, these are some of the things that are causing our community spread. No mask, people not keeping a distance, game day watch parties now, large wedding receptions, crowded bars, house parties, extended family gatherings with extended family. These ultimately, if you worry about your grandmother in the nursing home, this community spread is how we can control it, keeping that down. When it goes up, the odds of it getting into a nursing home goes up. When it goes up and is as high levels as we're seeing in many counties today, it threatens our K through 12 schools. When it goes up, it threatens ultimately our hospitals. So what do we do about this? In the words of two great Ohio State coaches, and let me quote from them, we do need to stick to our game plan because we know it works. Ohio, when we stick together, we always win. They said it very, very well. This is a game that we must win. And to do that, we have to get back to basics. We have to get back to the fundamentals. Wear a mask when you're out in public, when you go to a store, when you're with friends. Keep your distance, wash your hands often, work on the ventilation so you're bringing in more air from the outside in your home or in the public building that you're in charge of. If you're one of the 82 counties, you live in one of the 82 counties that is now a high incident county, let's be more specific. please reconsider hosting or attending gatherings of any size. This includes with friends and extended family, people who don't live in your household. 2, think about canceling events. Certainly don't go to Halloween parties. 3, wear masks inside and outside when you cannot social distance. Above the nose, over the mouth, secure under the chin. Stay home if you're not well. Cooperate with your local public health officials if you're diagnosed with COVID-19 or exposed to somebody who has COVID-19. Work remotely from home if you can. And we need help from our businesses. Allow employees to work from home when possible. A lot of people did that. If you can still do that, if that works, it's better. 2, send your employees communications urging them to take personal precautions to prevent the spread of COVID-19, not just during their time at work, but when they're home, when they're out and about. 3, for retail establishments, require customers to wear masks unless there is some specific exemption. Our problem is community spread. And because 82 of our counties are high incidence counties, I am today asking leaders in every single county to redouble your efforts. We've seen a lot of great leadership come out of mayors, county commissioners, business community, those in labor. We've seen people in our churches, our faith-based communities. So we've seen a lot of leadership around the state on this issue. And so thank you very, very much. Now, though, is the time to reevaluate in each single community, every county, exactly what you are doing. And so I'm asking you to pull together that group of leaders in the community, drawn from all different parts of the community. Each community really needs to reassess right now what it is doing and what it can do in the future. We are at a critical stage. Review certainly should include county commissioners, mayors, health commissioners, school and hospital leaders, college leaders, other community leaders, including those from the faith-based community, from business, and from the nonprofit sector. One of the great things about our state is the great communities and how people pull together, whether it's a large county or a small county, that people come together to solve problems. We are all in this together. What each person does or does not do will determine how well we do over the next few months before the vaccine arrives. I'm going to start meetings today as soon as this press conference is over. And we're going to start first with the 3 counties that are on the watch list. We'll do 2 of those counties today, 1 tomorrow. Then I will move to the highest of the high incidence counties. And again, we'll start with these counties and start working our way down. And again, we'll do a Zoom call. We'll bring people together and we'll just kind of talk and we'll exchange ideas. I'll be there. My team will be there to listen to your concerns, listen to where you need us to help you. And we'll tell you where we can help you. But these kind of meetings, I think, are very, very important. Now, it's going to take me a while to get down through the list, but we're going to do them as fast as we can. But obviously, in the meantime, we would ask you to pull together, set up a meeting yourselves, get on the phone, get on Zoom, get on however you can do it, and pull people together in the community, because it's communities working together that is going to make the difference. This is how we're going to beat this enemy. We have a common enemy. We have a common enemy, and that is this virus. And it's a virus that the trend lines will not change unless we change them. If we continue to do the same things we've been doing, we're going to end up getting the same results. So although many people are wearing masks, many people are being very, very careful, we need just to get our game up, and we need to get more and more people who are doing that. And this ground game, this grassroots effort, I think is really the key to getting this done. So I look forward myself to being on these calls. I look forward to talking with each and every one of you. But I'd ask you again to get started on that right away. We have the ability, working with local leaders, to offer some state support. And a lot of this we've already talked about and extended. Things such as increased rapid testing, additional personal protection equipment, help with contact tracing so people can quarantine and stop the spread in its tracks, help and guidance with air ventilation in buildings and other things. Look, we are Ohioans. We always come together. In a time of a flood along the Ohio River or one of our other rivers in the state, where there's been bad fires, when there has been tornadoes, we rally together. Our communities just come together like that. So we've got to do that in regard to this virus. We've got to come together and go after this invader, because we truly have, in fact, been invaded. If you're a county, Eric, let's look at that slide again. If you're a county with a high incidence, if you're up here, set a goal. Let's say you're Mercer at 478, or you're at Holmes with 398. Set the goal to knock it down 100. Set a goal to knock it down 200. Whatever that goal is, work in that community to get that done. Because when you take the cases down, you're going to take the hospitalizations down, and you're going to ultimately take the deaths down. It's really as simple as that. Our goal in the state should be to get every county should have an ultimate goal of getting under 100. That's the high incidence. We certainly have the ability to do that. And let's each one of us recommit. Let's look at our county and say, here's where we can block this virus from spreading more. We can take this action. We can do that. The ability to do that lies uniquely with you as the leaders in each one of our counties. Let me now turn to the Lieutenant Governor. John?
Thank you, Governor. Yeah, I just want to reiterate, I think that these calls that we're going to be doing are essential because we need to have a local strategy, a localized strategy to get at this as we see the virus spreading dramatically in every county in the state. As you articulated well, this virus is spreading at the community level, and the things that we do in our own personal time. We need people basically to take ownership of the problem at the local level, take action on the solutions at the local level, and it's going to take a community effort to get that done. And I believe that it's going to happen. I believe, as you said, people are going to rally to the cause. They're going to set a goal. They're going to be determined, and we're going to begin to move this trend in the other direction soon. But it's not going to change without that effort. I would, as I like to do, I always like to try to give some component of our economic recovery as we fight the virus and the economic consequences of the virus. I want to set a reminder for people. Look, I know that technology and the virus are changing the economy quickly, and people need to get retrained. This is a perfect time to do it. And through Tech Cred, we have the opportunity for employers of this state to upskill their employees, to upskill somebody perhaps that they want to hire into one of these new positions as technology is changing the role of those jobs. We will pay up to $2,000 of a person's industry credentials. Some of these industry credentials come with college credits associated with them. This is a great opportunity for you to engage. So if you're an employer and you want to upskill one of your employees, go to techcred.ohio.gov. The deadline for the latest round of applications is on Friday. We need to get this going. We talk about unemployment statistics at the macro level, but we know that the impact, the economic and social impact is at the individual level, about everybody being empowered to better prepare for their futures and to help your company and to help themselves in the economy. And this is one way to do it. techcred.ohio.gov. Enroll before Friday, 3 p.m. deadline. Thanks, Governor.
We're ready for questions. Thanks, Lieutenant Governor.
Governor, your first question today is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. Thank you for taking questions today. Earlier today, President Trump tweeted, "Fake news media is going full on COVID, COVID, COVID. We are rounding the turn." Now, you've painted a pretty grim picture today. Who should Ohioans be listening to when the president's saying we're rounding a turn and you're asking people to double down?
Well, I can only speak what I see in Ohio, and what we see in Ohio is we're not headed the right direction. We're headed the wrong direction. It doesn't mean we can't turn it around. Look, I give the president a lot of credit for putting the money in very, very early to develop the vaccine. We're going to have a vaccine, and the cavalry is coming to the rescue, or whatever your analogy you want to have. So there's hope out there. We're going to get through this. We're going to get those vaccines, and it's going to take a while to get it all out and get enough people vaccinated. But we can do that. But we've got to get through the next few months, and to get through the next 2 months and to keep businesses open, keep kids in school, keep things going, we've got to do the things that I talked about today. We know the recipe. As our two coaches said, we know what works. We've got the game plan. Let's just execute on it.
Next question is from Krista Frost at WBNS in Columbus.
Yeah, so at the beginning of the pandemic, many things were shut down so we could flatten the curve, and we're seeing a spike now, obviously. So what's the difference from then to right now? Should people expect to see another shutdown?
Yeah, here's the difference. We already did that once, and we saved a lot of lives. And Ohioans should be very proud of where they are or what they've done in the past. Twice they have been able to knock this virus down. But we know that a complete shutdown will have other consequences that are not good. And so, we had kids who lost March, April, lost a few months. They had remote, but they were certainly not in class. We had businesses that were shut down. We had other bad things come, mental health problems, et cetera. So we don't want to shut down again. We've done it once. We just can't do it twice. Or we certainly don't want to do it twice. We want to avoid doing it twice. And so the game plan I've outlined today, very short, very simple, very easy, will get us out of this. And we will not have to shut down. But if we don't do this, and if we don't fight this battle county by county, city by city, village by village, if we do not fight in that way, we will, one way or the other, be shut down. And we will be shut down because the spread will be so bad. So look, we have Thanksgiving looming. We have Christmas coming up. It is getting darker in the sense that we're losing light. And, look, people are inside more just because of the cold and because of the when it gets dark. So people are inside a lot more. And we know it can be a very dangerous time for the spread of this virus. So we got to make a correction really quick. And that's what we got to do. But we know how to do it. We've done it twice before. I'm asking Ohioans to do it again.
Governor, if I could add to that answer, the place that the governor highlighted earlier today, the spread is not coming from businesses. It's coming from what people are doing on their own personal time. And so a shutdown doesn't affect that. We're trying to target the solutions to get people to own it at the personal level, because that's where the solutions lie, is what we do on our own personal time. Businesses have shown that they can create a safe environment, and they're doing that across the state. And we need to focus the solutions on where the problem is.
Some of my best friends in the legislature talk about personal responsibility. I'm a big believer in personal responsibility too. I know they are. this is about personal responsibility and what each and every one of us can do.
Next question is from Scott Hallis at the Xenia Daily Gazette.
Hey, Scott,
Hey, Governor, how are you?
I'm good.
Just a question. We've got winter sports coming up in Ohio. Teams are starting to try out. They're picking their teams. And I know there's limits, as far as there was limits for volleyball, how many people can be in a gym or whatever. Has there been any thought given yet to what's going to happen in the winter when you have wrestling, basketball all inside, swimming, bowling all inside the same places? Are there going to be more stricter limits because of the community spread, because people are inside more now?
Well, I had a superintendent today, this morning, email me and recommend that we, postpone winter sports into January, see where we are. I don't know the answer, Scott, but I know what I can tell you and everyone else is the spike we are seeing, what we're seeing threatens everything that we want to do. We got to get control over it.
Next question is from Alex Ebert at Bloomberg.
Thanks for taking our questions, Governor. Early this spring, Dr. Amy Acton said that projections showed there would be about 10,000 new cases per day. Then later, after steps were taken, we saw that projection decreased to about 1,600 cases per day. We've now blown past that sort of projection on a daily case basis. What are the current projections and your health experts saying we could see as far as a peak of new cases per day goes in Ohio if things continue the way they're headed? Thanks for your time.
Yeah, we reviewed a projection yesterday. It didn't come from Ohio. So I'm going back to our Ohio folks and take a look at it. But it was this projection was stunningly high. It was so high that I said, we got to go look at, let's try our Ohio folks, see what they say. So I don't have an answer today. I'm going back to some of the folks that do modeling at our universities here in Ohio and kind of see what they come up with. Again, I think the caution always on this is what assumptions are you using? And one of the key ingredients I will tell everybody as we talk to modelers is what percentage of people are wearing masks. That's always one of the key inputs into that. So we know from them and from what we've seen in Ohio that wearing masks is fundamentally important. It is back, and that is, as I said at the beginning, back to basics. So there are things that we know will change the outcome.
Next question is from Dan DeRose at WOIO in Cleveland.
Good afternoon, Governor. How are you?
I'm good. Thank you.
So I know you're not a fan of the phrase herd immunity. You prefer community immunity. So my question's sort of along that line. When you look at 202, when you look at 202,000 positive cases in the state of Ohio, that represents about 1.6% of the state that's actually tested positive. Granted, we know that to be much higher. Not everybody got tested early on that had symptoms and probably had it. So experts are saying maybe around 5%, at least here in Cuyahoga County. Are we seeing higher numbers now because we did such a good job early on and we did close down early and we did wear masks in July? Is this just sort of the vaccine not going away and we're not ever going to be able to avoid getting above 1.5% or 5% people getting infected?
Well, clearly, the more people you have infected, assuming that this immunity lasts, and we've seen some cases where someone got it again. So I don't pretend to be the medical expert, but obviously, if you've had more people get it, then if they do have immunity, you would assume there's fewer people who can get it in the future. But, that would be a horrible, horrible strategy. It would be a strategy that basically said, let's get everybody exposed. And there's no reputable scientist that I'm aware in the world who thinks we could reach herd immunity in any close proximity of time. I mean, I've heard numbers from 60 to 70, 75%. that you would need to get the herd immunity. Again, I'm not the scientist, but we're not even beginning down that pathway. So, you know, we are seeing the spread because it's spreading and because we're not doing the interventions that we need. And we know the things today, you know, we know a lot more than we knew in March and February. We know that these masks are phenomenally effective. Not perfect, but they're phenomenally effective. So, you know, the idea that we get herd immunity, community immunity, whatever you want to call it, it's been a discredited theory in regard to the coronavirus because no one thinks we can get it in a reasonable period of time. The other thing I would say is that by saving lives early, you know, and we not only are saving lives, but if someone, I mean, I said early on at one of these press conferences, if you had a choice of getting it in February or getting it in November, you'd be better off getting it in November. We don't want anybody to get it, but doctors know more and they know how to treat it more. It's still not curable. We're still losing people every single day, but they certainly know more. So the idea that we can herd immunity our way out of this is been discredited by everybody. The only way you get the herd immunity or community immunity is we're going to get it is through vaccine.
Next
And
question.
we'll get it, and it will come.
Next question is from Andy Chow at Ohio Public Radio and Television.
Andy.
Hi, Governor. Back in May, there were leaders in the legislature that wanted you to start addressing the pandemic county by county rather than a statewide perspective. Now it sounds like the game plan is going to more of a county by county level. What's the explanation for the game plan there? And then do you also expect possibly counties to be shutting down businesses on a county level?
Well, let me talk about that for a moment. You know, we made the decision early on to treat the state as one unit. A part of that was legal. We believe that, for example, in regard to bars, you have to treat it equally. We know that legally, if there's any discrepancy between one county and another, you know, the burden's upon you to show why you're making a distinction. But that had to do with shutdown. What we're talking about now is really taking community work up to a higher level. We've got a lot of great mayors, a lot of great commissioners, a lot of great health commissioners, a lot of great leaders in the faith-based community who are doing a bang-up job. All we're saying really today is let's reconcentrate our efforts because whatever your county was before, it's higher today. And for those counties in the spring where it was clearly in the urban areas, if you lived in a rural area, you were not having much impact. Now, no matter where you are, you've got to go deal with it. So what we're simply saying, particularly to the smaller counties who had avoided this for a long time, we're simply saying, hey, we need you. We need you to come in. We need you to rally and to do that. But this is not the state backing off, nor is it, am I saying I shirk any responsibility. I'm just saying we need more players on the field. We need more troops on the ground. We got to all be in. And for the counties that could get by in the spring and not be in, I understand that. They weren't seeing it. Today they're seeing it. Today their nursing homes are threatened, to their hospitals are threatened, and their schools are threatened. That's the difference.
Next question is from Jeff Reddick at WSYX in Columbus.
Good afternoon, Governor. The Big Ten continues to have its games, obviously. Here in Columbus, local health experts are worried about the house parties, the unofficial tailgating going on in neighborhoods. They've asked the Big Ten to reconsider having night games or cable games because not everyone has access. They have to crowd together to be able to watch the game, but they feel they're being ignored by the Big Ten. Would you reach out on their behalf? Have you been approached about doing so? Does this worry you?
Well, to answer the one question, I not thought about that as far as when the games were scheduled or where the games were what they were available on. So we certainly can take a look at that. My concern about Big Ten football has always been not what goes on in the field, They're following very strict protocols. It doesn't mean you can't have spread. They certainly could. But I do believe that the athletes who are under that protocol, who have a great desire to play, probably are certainly as safe and maybe safer than it's just an average student. But what I've always worried about and continue to worry about, and I was talking to Mayor Ginther today and talking to some other mayors, is simply what do people do? They're watching the game, and they bring a bunch of people together. And that's why, this is what I said earlier on, really reconsider those. I know it's more fun watching Ohio State when you got, a bunch of people and you're drinking beer or you're eating something and pizza or drinking pop, whatever. But let's enjoy the season. Let's enjoy the game, but let's don't get the virus because of it.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor.
Danny.
So I know when people ask you about the president, you like to say you want to focus on Ohio. Well, the president came to Circleville in Central Ohio, and you greeted him at the airport, tacitly endorsing this huge event that he was holding in Ohio during, a time that's really bad.
Look,
what message does that send? How do you justify that?
I justify it this way. I'm the governor of the state of Ohio. The president of the United States comes here. I want to greet him. It's important for the governor of Ohio to have a relationship with the president of the United States. And I think that is important. I was not at the rally. Look, I've made it very, very clear that whether you're at a rally, whether you're at a protest, whether you're at a football watching party, gathering together without masks, with virus that has spread as deeply as it has into every crevice in the state of Ohio is a mistake. And so, I again would urge people, wear masks, whatever you're doing, and those, particularly if you're close to someone else and you can't do the social distancing. So please understand exactly what it was. It was the governor of Ohio greeting the president of the United States. And I've also endorsed him, and I continue to endorse him.
Next question is from Laura Bischoff at the Dayton Daily News.
Hey, Laura.
Hey, Governor. So 82 counties are at this high incidence of red or orange. None are at purple. Is your administration not categorizing counties as purple until after the election?
No. Oh, no, this is all on data. Our data people tell me what it is on Wednesday, or usually it's late Wednesday, sometimes early Thursday. They confirm it again right before the press press event at 2:00 on Thursday, and I report whatever they tell me to report. No, this is on data, basically on data. We've got 3 counties that could go purple. But remember, under the criteria, they have to continue, they can't just still be, they've got to see the increase continue to go for that last week. So they've got to do it 2 weeks in a row. They've got to have that growth, that significant growth for 2 straight weeks. I mean, we could have shown, that's the way we set it up. It takes 2 weeks in a row to do that. So this would be the second week for those 3 counties, and I don't know whether they're going to hit that or not. If they hit it, we'll call it.
Next question is from Max Philby at the Columbus Dispatch.
Max.
Afternoon, Governor. I know you've said that you would like to avoid another economic shutdown like we had earlier this year. So with that being said, could we see more along the lines of capacity limits and things like that at bars, restaurants, and stores, maybe more so than just the 6-foot distancing that we have in place now?
Yeah, I'm really I mean, they've got to, those outliers have got to do what they should be doing. And if they don't, there needs to be consequences, and there will, in fact, be consequences. But in answer to your question, I'm not taking anything off the table. Please don't misunderstand. As governor of the state, I'm going to do what I have to do. But I know, as John Husted said, and he's spot on, that where we're seeing the spread, the big spread at least, generally is in people's own personal lives. That's why we ask business to jump in and talk to your employees about being safe when they go home. That's why we're talking to any community leaders to talk to people about that, because that is an area that, we don't have any really control over. What people do in their own home, what they do in their personal time, those things, that's where personal responsibility has got to come in. And that's what will really make the difference. But no, I'm not taking anything off the table. We'll do what we have to do.
Next question is from Amanda Van Allen at WEWS in Cleveland.
Hey, Governor. I know you talked about this a little bit a couple questions ago, but I wanted to clarify something. I know that the counties usually change over color every Thursday, and you talked about 3 counties potentially going purple. I'm most concerned about Cuyahoga County over here in Cleveland. Is that one of the 3 counties?
Yeah, I mean, and this is not any news today. I mean, there were 3 counties were on the watch list last Thursday. What that simply means is they hit the criteria last Thursday. But under our way we set this up months ago, they've got to hit that twice in a row. And so we're going to see, Thursday what they hit, whether or not they become purple or they don't become purple. Again, I would just caution everyone that, you got to look at 2 things. Look at how much spread you've had, how many new cases you've had in the last 2 weeks per 100,000. That's very, very important. The other thing is look at the color. And when you get to purple, what that's indicating is you got potential problems in your hospitals. That's why purple is so important.
Next question is from Jesse Balmert at the Cincinnati Enquirer.
Jesse.
Hello, Governor.
Hello.
My question is about the size of events like the rally in Circleville this weekend. I guess, will you ask presidential candidates to limit the size of their events, similar to the ask that you're making to people attending football parties this weekend?
Look, we're asking people consistently to wear a mask. You could have a football party if you wore a mask. You have to be careful. You'd have to, you've got to make that judgment call. But wearing the mask is what we're asking people to do. I wouldn't suggest they do a big party for a football game. If they can be outside and wearing masks and watching a screen, that may make some sense. Every situation is different. And so I did ask last week, in anticipation of the rally in Circleville, everyone to wear a mask. And I will, continue to do that. There was an event, a Trump event in Youngstown. I picked up the phone the morning that it was going to occur and called into the radio station and talked on the Dan Rivers show. And the reason I called in is I wanted to say, please wear a mask if you're going to this event. So I think, I'm consistent in that.
Next question is from Josh Rottenberg at Spectrum News.
Hi, Governor. How are you?
Hey, Josh.
You just said about 20 minutes ago, if we don't fight this county by county, village by village, we will one way or another be shut down because spread will be so bad. So at what point will we be shut down? Is it when counties reach purple? What is that exactly?
Josh, I've said this before, and let me kind of try to articulate it maybe better. What will happen is what we're already starting to see happen in some communities where the schools have to go remote, but they don't want to go remote, or where they planned on coming out of remote and they stay remote because they're seeing spread. We're seeing schools that have been totally open 5 days a week that have had to pull back for a couple of weeks. Why? Because they had an outbreak in their school. You'll see it in nursing homes. The spread in nursing homes comes from people generally who are going in and out the door, and most of those people work there or they bring supplies there. So when you've got broad spread in the community, you're going to see broad spread eventually you're going to see spread in the nursing home, no matter how much they try. Same way with hospitals. We'll start to see things happen in hospitals where they'll say, we're not going to do elective surgeries, or we're going to pull back from this or pull back from that. So look, we're watching it. We look at the data every single day, but to this point, we still have it within our control. It's still within the control. We can have it within our control. And that is if the people of county after county get mad and say, we're not going to put up with this virus anymore and we're going to go beat it. That's what we need to have happen. And we got to do it. And we can do it.
Governor, next question is the last question for today, and it belongs to John London at WLWT in Cincinnati.
Hey, John.
Hi, Governor, you said a moment ago the heaviest lift is with personal lives, and that you're going to meet with watch list counties and start that right after this briefing, Hamilton County being one, of course. I'm interested to know who you will meet with, and what do you want in place, Governor, besides better messaging and encouraging mask wearing?
Yeah, I think that, particularly with smaller counties, I think there needs to be an acceptance that we got to go win, that this is a battle worth fighting. And we need all the county commissioners, frankly, or county executives. In case of Cuyahoga County, for example, Summit County, we need all the opinion leaders. We need everybody in the game. So I'm looking generally for about 10 people on these calls. And look, it's going to be an exchange. I'm not going to sit there and tell them what to do. It's going to be an exchange. We're going to make sure they understand what resources we have that we can bring in. I've always found talking with people, communication is good. We've had a lot of communication during this, but we're going to make this more formal. And so we'll go right down the line. I mean, I talk to, Mayor Cranley twice a week at least, and I talk to mayors and commissioners all over the state, but we're going to do this more formally and just methodically do it. Let me close by saying on this date in 1858, our 26th president, Theodore Roosevelt, was born. And let me say something that from his 1905 inaugural address, which I think is pertinent to what's going on today. And I quote from Theodore Roosevelt, "Much has been given us, and much will rightfully be expected from us. We have duties to others and duties to ourselves, and we can shirk neither." It's time for us to go to battle and to go defeat the virus. We'll see you all in a couple of days. Thank you.